All right, detecting any cancer early can be life-saving. That also goes for breast cancer, which is why it's so important to know your body and have your screenings regularly. Joining us to talk more about this early breast cancer detection is Dr. Camelia Lawrence, Director of Breast Surgery at the Hospital of Central Connecticut, MidState Medical Center. Doctor, welcome.
Thank you for having me.
Thank you for being here. So, as a breast cancer surgeon, what are your main concerns in the age of COVID in terms of breast care?
Well, with the onset of the pandemic, many of the breast cancer services were delayed. There were several women who failed to report for their screening mammogram, perhaps even a short interval reassessment that was recommended. So I'm very concerned that these patients may present at a later stage of diagnosis. And as we know, early detection is key.
It sure is. Boy, great message. So COVID caused many women to delay or not schedule their regular mammograms. So how can they get back on track?
Well, the recommendation is to schedule it today. If you have skipped or postponed it, or if there's a short interval reassessment that was recommended, get it done. Our spaces are safe for you to come in to have your screening studies performed. In addition, if you're experiencing any symptoms such as a breast mass or any sort of skin changes, please do seek medical attention as soon as possible.
All right, when should women get a mammogram, and are there certain factors that play a part in that schedule?
Well, for the average risk woman, the recommendation is age 40. However, if you do have a strong family history of breast cancer or perhaps a known genetic mutation within your family, that age may be much earlier. It could be as early as age 25. So it's very important to have a discussion with your physician to know when you should begin screening.
Yeah, I got mine during COVID. I did a story. It wasn't painful. I was very safe. So I do recommend women to get back on their schedule. All right, Hartford Healthcare, you have an upcoming webinar. Tell us about this, doctor.
We do. We have an exciting webinar coming up on Thursday at noon. And what we're planning to do is really to talk about how can you stack the odds in your favor. There's often no rhyme or reason as to why a woman may get breast cancer. In fact, the majority of women who develop the breast cancer, they're the first in their family. So what we're providing is it's a free class. You can log on and you can sign up ahead of time. And the number to call for that is 1-855-442-4373 to sign up. It will be an informative discussion and a lot of questions will be answered.
And doctor, finally, we're showing the website and the number on the screen, but how can you reassure women that it is safe to get a mammogram?
Well, we've taken all the necessary steps within our various spaces to protect both our patients as well as our staff. There's several measures that are in place, and we've been going seamlessly throughout the pandemic, and a lot of resources have been deployed to make sure every woman that sets foot within our center is safe.
All right. I love the way doctors are spacing out the patients, cleaning the rooms more. It feels very safe. All right, Dr. Camelia Lawrence with Hartford Healthcare, thank you so much for joining us. Early detection in breast cancer, such a great topic, always informative. Thank you.
Thanks for having me.